So in order to treat the calf, you can use the rolling pin or the water bottle. You place your calf on the rolling pin down by the heel. Form a little tripod between your opposite foot and both hands. And you just roll the calf about 2/3 of the way up and back down to the heel. If you're not feeling anything in this position, you can place the other foot over top of the leg you're treating. That'll produce a lot more pressure through the calf. This should be mildly uncomfortable or even painful, and if you find a painful area of the muscle, you want to spend more time on that area. If it's extremely painful, take some pressure off and ease into it, starting lightly and gradually increasing the pressure until you can bear all of your body weight through the rolling pin. Do this for about a minute. Third is the quadriceps. There are 3 regions of the quads we want to treat. The medial side, the vastus medialis, the top of the thigh, and the vastus lateralis, and the lateral side of the thigh. The rolling pin works best for this. With your knee in a fairly neutral position, my legs bent at about 45 degrees, you start rolling into the vastus medialis. The vastus medialis extends about 2/3 of the way up the thigh, so you can roll that entire region on the inner side of the front of the thigh. If you're experiencing anterior knee pain, this muscle probably is very sore. And this type of treatment will help relieve your anterior knee pain. So after about 30 seconds to a minute, you can roll along the top of the thigh, where the vastus intermedius and rectus femoris are. Roll the entire extent of the thigh for the top. Now my shoulders are placed directly over the rolling pin so that I can get really good mechanical advantage to push as hard as I want. And again, you'll want this to be mildly uncomfortable to really get the best effect. That means you're pushing deeply into the muscle. And if the muscle is tight at all, it probably will be painful because lactic acid has probably accumulated. This type of deep tissue myofascial release helps restore the blood flow, and it loosens the connective tissues so that the muscle can function properly. And as the blood flow is increased, lactic acid is flushed out and the muscle soreness will go away. So gradually, after about a minute or 2 of doing this, the muscle won't be nearly as sore. And after a few days, it probably won't hurt at all unless you had a really hard workout the day before. So now I'm on the vastus lateralis. And again, we're going to go all the way from the hip, all the way down to the knee. Deep, broad strokes over the vastus lateralis. The vastus lateralis is the primary muscle that dysfunctions in IT band syndrome. The IT band actually does not contain any pain receptors. So the pain from IT band syndrome is most likely coming from the muscle that lies just beneath the IT band, the vastus lateralis. So after about at least a minute over the entire quad, possibly 2 because there are 3 main areas that we have to treat, we can then move to the hip. The muscles that we primarily want to treat on the hip are on the side of the hip abductors. And the hip abductors are fairly short, and they pass between the upper part of the thigh and the crest of the pelvis. So in order to get to those muscles, you have to sort of lay on your side with your bottom leg relaxed, and you can use just short strokes over top of those muscles, bearing your body weight through the hip so that the rolling pin can penetrate into the muscle. this will probably be sore even if you don't have any symptoms or don't normally have pain in the hip. These muscles generally get tight, especially in runners, so it may be a little bit uncomfortable. These muscles are really hard to stretch, so this is the most effective way to keep these muscles working properly. And you can shift your body weight more onto the back side of the hip. I'm bearing weight just through one hip right now on the rolling pin. And just nice broad strokes over the gluteal mass. And again for about a minute. So, what these exercises do is a form of myofascial release that does three main things. One, it loosens the connective tissue so that the muscle can elongate like it's supposed to during shock absorption phases of gait. Two, it restores blood flow. So if the muscle has been tight for a while and the blood flow is restricted, this helps restore the blood flow and flushes out the lactic acid that may be causing muscle soreness. And three is a neurological phenomenon that involves reflexes called stretch reflexes. These muscles, when they absorb shock and they elongate during shock absorption, they actually produce a reflex called a heteronomous stretch reflex, where the stretch of a muscle produces contraction in other muscles. And as we run, which is a reflexive activity, the stretch information from these muscles that we demonstrated here today, the stretch information from those muscles is responsible for the whole pattern that we use to run. And when these muscles get tight, the gait reflexes become impaired, mechanics break down, and injury usually occurs. So, as a primary defense against multiple types of running types of injuries, these four activities will help prevent those injuries. They'll help restore muscle flexibility, blood flow, and ultimately they'll increase their endurance as well, because the blood flow is restored and they can extract oxygen better as there's more blood flow. So try these out. You should do these before you run and after you run every time. Just spend 5 or 10 minutes and you'll be happy you did. Your times will probably improve, your endurance will improve, and you'll have less muscle soreness when you're done running. So I hope this was useful. Check out the blog, trecoblog.com, if you're interested in learning more about this information. I'm Scott Hadley. Thanks for watching.